I offer my humble pranams at the lotus feet of our beloved Bhagwan, Sri Sathya Sai Baba. Sairam to all. Thank you for joining us for today's healthcare webinar on emergency medicine outside of the emergency department. We are truly grateful to today's facilitator, Dr. Sneha Singh. She completed her medical studies at Kasturba Medical College in Manipal, India. She is a fellow of the Royal College of Emergency Medicine in the UK and currently works as a specialty registrar at the Royal Berkshire Hospital in Reading. Dr. Singh is an instructor in advanced life support, in advanced pediatric life support, and in advanced trauma life support. Dr. Singh considers herself lucky to have been born into a Sai family. She attended Bal Vikas classes in Bangkok, where she grew up and completed the Sri Sathya Sai International Leadership Program in 2018. Before the current pandemic, Dr. Singh has also participated in international medical camps in Puttaparthi. Today's webinar is particularly useful, I believe, and should be of interest to many, especially at this time of the pandemic when going to the emergency department could be quite a challenge. So I pray today's webinar will be of help. Please keep safe and look after yourself. I now have the pleasure to hand over to Dr. Sneha Singh. Jai Sai Ram.
Om Shri Sai Ram. Before I begin, I would like to offer my humble salutations at Bhagwan's beautiful divine lotus feet. And I would like to thank Bhagwan for giving me this opportunity to be who I am today, to take me down this career path, and also to giving me this opportunity to impart some of my experience and share some of my experiences with you. Without any further ado, I'd like to begin. Swami always says that health is wealth, and I think sometimes we often forget how lucky we are to have the body, mind and soul that Swami has given us. In emergency medicine, often people come to us in their worst situations, the worst days of their life, and being there to help them really makes you feel grateful for the things that you have. The body that we have, the mind that we have, and the soul that we have. But it is also very important to emphasize that as Swami has given us this body, mind and soul, we need to prevent it from getting ill. We need to stop abusing it the way that we do at times. And Swami has given us very practical things to follow that affect our life day to day. So, for example, vegetarian diet. We all know that the vegetarian diet is the best diet to have, essentially. It covers all of our nutrients without harming the planet, without harming our cells with tamasic qualities. Exercising as well. Swami has always emphasized on exercising. We have always read about the sports meets that Swami always encouraged his college students to have to participate in. Swami also mentions on not overeating, and he specifically said once that you should feel as light sitting down for dinner as you do when you get up from your dinner. So there's no more of that, oh my goodness, I've overeaten so much that I can't even get up, because that, Swami says, instills tamasic qualities in us. Then there are other things that we can definitely do to help our health, and one of which is to avoid processed foods. I think that's very important. In today's day and age, everybody leads a very, very busy life, and we are all just so used to buying lots of processed foods, but trying to understand that this is not really good for us because of the preservatives they add and the other chemicals that are in them. Of course, if we all had the luxury to, we would be growing our own fruits and vegetables. I know for some of us it is possible, but for some of us it isn't. And, the ultimate thing of no smoking, no alcohol, no drugs, I think these things are just very important to reiterate as well. Swami has given us lots of lifestyle advice to look after this God-gifted body that he's given us. In the UK and across the world, life expectancy has stalled in the sense up until the last decade or two, we were seeing people's life expectancy increasing, but now it's come to stay about the same. And unfortunately, past COVID, the life expectancy is even decreasing in some areas as opposed to just remaining where it is. And part of it has got to do with, inequalities in a healthy life expectancy between the most and the least deprived areas. For example, you'll notice that food at McDonald's is cheaper and easier to source than food at a more, slightly more expensive restaurant, which might be of a better quality. But there's only so much that you can do, and there's only so many things that you can try and avoid, and because at the end of the day we are all very busy and we are trying the best that we can. And what I would say is control the things that you can change, but Swami is there for the rest. And Swami emphasizes so much on the food prayer, and I think that's one of the most important things, regardless of what you're eating, even if you're going out for a meal. Saying the food prayer takes out all of the tamasic qualities from the food and therefore makes you filled with this nourishment that would have otherwise harmed you. So the food prayer is very important, and just leaving the rest to Swami, saying that you've tried your best to be able to take care of the physical body to the best of your abilities, and the rest is in Swami's hand. So moving on to what we're going to cover today, which will be injuries in particular. I can't complete any talk on injuries without actually saying that most, if not all, injuries are preventable. So just a few points, a few slides about prevention of injuries. We'll start off with fire safety. As we are in winter now, a lot of us have heaters, some of us may have open fires as well. I think it's very important to emphasize that make sure you keep all of the fires well guarded, and if you've got fitted or portable heaters, make sure that they have a built-in guard. Especially if you've got children or older people at home, try and block out the radiators, etc., with some furniture, so that if they were to accidentally trip or brush onto something hot, it wouldn't burn them. We all have candles at home, or we light diyas for aartis at our altar. I think it's very important to be sure that there's nothing flammable around it, especially things like flammable parts of furniture such as curtains. That's very important to keep in mind. I would encourage everybody to have smoke detectors as well at home, especially if you have open flames at home, and if you go out after you've lit them. It's quite important to keep smoke detectors. Then moving on to electrical safety. I'm sure I don't need to say this to people who have kids. They all know that kids like putting their fingers where they shouldn't have to, and electrical sockets is one of them. So buying socket protectors to protect the children. Electrical appliances in the bathrooms. A lot of us have these electrical appliances, and making sure that as soon as they're charged that we disconnect them and keep them away, and keeping them away from water is very important as well, to prevent electrical burns. Then heating and cooking is very important, and I think This is where a lot of the injuries come from. Carbon monoxide monitors are quite useful at homes. Carbon monoxide is a silent killer, and unfortunately there have been people who have died with this poisoning, and it is entirely preventable by just having a monitor at home. One of the classic signs of carbon monoxide poisoning is that if everyone in the household gets a headache or is drowsy while being indoors, but as soon as they go outdoors in a few minutes to a few hours, they start feeling well in themselves and their headache disappears. Kitchen nightmares, of course, unfortunately this does happen, and there are a few things that can cause harmful injuries in the kitchen. One of them, of course, very particular to kids, I would say, is wanting to pick up some hot cups of water, tea, coffee or soup off the kitchen counter, or if the kettle has some hot water in it, they can easily pull it, and if they're young children, they could easily get scalded as a result of this. Keep knives out of reach of children, please. Unfortunately, we have seen a lot of injuries with kids accidentally getting a hold of knives. We've seen some injuries in adults as well with knives, especially when they're trying to cut avocados. So just be very careful of when you're cutting avocado, especially because it's one of those very tricky things on how to take out the seed of the avocado. And then bioethanol and gel fuel burners. I think it's unlikely that some of us that will come across bioethanol and gel fuel burners, but they are generally found in fondue sets or small fireplaces or like patio torches. So they're mostly used in commercial settings, but if you have it at home, I would probably say try and avoid using it, because accidental burns are very, very common with these sort of fuels and these burners, because we're not used to handling them at home. Stairs and carpets is another important thing to remember. So you need to secure all the rugs that are around home, especially if you put them out during winter, and prevent using rugs at the bottom or the top landing of the stairs, because that can sometimes cause people to accidentally slip or get their foot caught on it and fall. You could use double-sided carpet tape that you get in B&Q, etc., to keep the rugs in their place. But I would, if you've got elderly people at home, I would avoid keeping rugs altogether. Instead, just use carpets as you would normally. The other thing that I would just like to remind you is regarding stairs. If you've got stairs outside your home, and if that particular area outside your home is not well lit, then please make sure you paint the edges of the stairs with white paint, so that even at night people can easily see that there's a step there. Otherwise it makes it quite difficult to differentiate, and people think that it's a flat surface and are very prone to falling as a result of it. Then safety glass. Safety glass is specially made, and thankfully they are the most common type of glasses that we use now at home, especially on our windows, etc. They are basically made of laminated or toughened glass, so when it breaks safely in a way that it's less likely to cause any injury, and is less likely to cause any cuts or sharp edges that could cause any cuts. So just something to keep in mind. Then safety with medicines and cleaners is quite important. If you've got children at home, please, please, please lock away all of the cleaners, all of the medicines that you have. Children are very notorious eating things as well. The small packets of the dishwasher or the washing machine pods, they're quite colorful and very attractive to children, and somehow they do manage to get across the safety valves of the boxes themselves. So actually taking that extra precaution and keeping it locked is very important. Please do not take other people's medicines, and don't let other people take your medicines unless it's an over-the-counter medicine. Seen that very often as well. It's just because unless it's prescribed to you, it's not very useful to take those medicines. So please get appropriate help for your condition before taking somebody else's medicines. The other thing before I move on to DIY is cleaners. Just a quick reminder to people that when you're cleaning your house, please do not mix household cleaning products, because if you mix several household cleaning products, they can create fumes that can lead to quite bad respiratory problems. So follow instructions as per the individual cleaning product itself, and make sure you open the windows and air out everything before you use the next cleaning product. And also, cosmetics, perfumes, essential oils, these sort of things children always want to get a hold of as well. So try and keep that away from children as well. So now moving on to DIY and garden safety. Please always plan ahead when you plan to do DIY. Accidents happen more easily if you're unprepared and if you're in a rush. Make sure you're wearing appropriate clothing and sturdy shoes when mowing the lawn, and also keep your hands and feet away from the mower blades. Make sure you follow the maker's instructions very carefully, especially when you're using adhesives like super glue. Be realistic and please don't tackle a job unless you actually have the ability to. I think this goes out to most dads who are tuning in, including my dad. Some plants and berries in the garden can be dangerous and can cause allergic reactions. So if you are dealing with a new plant or a new fruit or a berry, please make sure you wear gloves and dispose of them once you've done your gardening. So now moving on to the substance of the talk, which is management of injuries itself. In this talk, I'm going to be covering a few things. So cuts, bruises, burns, amputations, and the first aid management of these. Now, these injuries can be quite distressing. I've added a few pictures onto the slideshow, but I can appreciate that it's not everybody's cup of tea and it does look distressing to some people. So please, if I may ask you, if you think you are one of these people who would prefer not to look at the screen, I will give you a 5-second warning before there are any pictures coming on my slides, and I will let you know when I've moved on to the next slide for you to tune back in. So if you need to minimize, or if you need to minimize the screen or look away from the screen, please do during those 5 seconds that I give you. So the first thing we're going to be talking about is first aid at home for cuts. This is a trigger warning, so I'll give you 5 seconds to look away. So starting off with cuts can be as small as this, which I'm sure we've all seen, and I would probably call this more of a scratch than a cut, to something a bit more deeper like this. So when we look at cuts over here, so what you can see is that it is quite deep, and the edges of the cut, so this edge and this edge over here, have sort of started gaping essentially. And this white stuff that you're seeing in here is the subcutaneous fat, which we all have. If it was any more deeper, we would start to see a few tendons coming over here as well. and possibly some arteries and some nerves. I've moved on to the next slide. So for those of you who are looking away, please feel free to come back on the screen. So cuts are relatively easy to manage, and I don't think I need to preach any of you about this, but just a quick reminder that, if you're helping others who've had a cut, please make sure that your hands are clean before tending to others. The first and foremost thing to do with the cut is to stop the bleeding. So direct pressure on the injury itself with a gauze, bandage, or a clean cloth like a clean kitchen towel, if you don't have any gauze or bandage, should be okay. Make sure you keep the injured part of the hand or wherever it's injured above the level of the heart. And this basically reduces the amount of blood that's going to the area and therefore will prevent excessive bleeding. Avoid using cotton, and this is because cotton often adheres to the wound itself, and when taking off the cotton, sometimes it may disrupt a clot that was already formed and may start bleeding again as a result of it. It's important that you clean the wound with running tap and at a temperature that is comfortable, so not too cold, not hot either. Room temperature is okay, or lukewarm is okay, as long as it's comfortable when it's going through. Depending on how dirty the wound is, if a wound is very dirty, a lot of people would prefer running tap water and washing their injured part first before applying pressure and stopping the bleeding. And then once it's cleaned, once the bleeding has stopped, you can apply a non-adhesive dressing like a band-aid. And after that, you've got to watch out for signs of infection, of course, in case you need any antibiotics. So when to get help when you have a cut? If the wound does not stop bleeding. So this is very important. If you've applied adequate pressure for 20 minutes and the wound is persistently bleeding, I would advise that it probably needs some amount of professional looking into it. Alternatively, also, if a wound is just oozing out, it's normal that it oozes, and that's likely a venous cut and therefore will stop bleeding with pressure. Unless, of course, if the patient's on blood thinners, etc., it does make it difficult to stop those bleeds as well. But if it's spurting, if it's got an episodic spurting from the wound, then it is likely that the artery is severed. So the artery is quite high pressured, and therefore just with local pressure on the wound itself, it sometimes is quite difficult to get good control of the bleeding. And in those cases, often we would want to see them to decide how to close the wound and how to suture the wound. If you see a foreign object in the wound, it's important to get help. Of course, if it's something very obvious and as soon as you turn on the tap and you wash it, it goes away and it flushes away, it's fine. But if there is a foreign object in the wound, I would avoid picking it out yourself, just because you might not have the correct utensils to take it out, and also sometimes taking out something that's lodged in a wound may increase the bleeding itself. So just be a bit wary of foreign objects in the wound itself. If the wound looks infected, so if there's pus coming from the wound, if it's increasing in pain, or if there's any surrounding redness. A little bit of surrounding redness is normal because that's your body's way of sending lots of blood to the area to help in the healing process. But if you notice that the redness is increasing overnight or during the course of the day, then it needs to be looked into. If you're unsure about the tetanus vaccination, this is seen more in developing nations, but fortunately less so now. Although there are lots of people in this country as well who haven't had their children vaccinated against tetanus So if you're unsure about the individual's tetanus vaccination status, it's always better to bring them to the hospital for it. If the cut is deep or the edges are widely separated, it is unlikely to heal on its own. It will need some form of wound closure, which can be in the form of stitches or some glue, or maybe even some steri strips, which are basically like tape that we can put on top of wounds and that bring the wound together. So now moving on to bruises. This is a trigger warning slide again. I will give you 5 seconds. So if you've got kids, I'm sure you see this very often, where you've got bruises on the knees, and that's completely fine. But of course, a lot of people get bruises like this as well, which are quite extensive and look quite horrible, to be honest. I've now moved on to the next slide, so if you were looking away, please feel free to look back on the screen. So bruises, remember to ice them. The first 24-48 hours are probably the most important, but please remember to wrap the ice in a towel and not to apply the ice directly on the wound itself, on the bruise itself. Resting the injured part is the best thing to do. And if you notice that there's a bit of swelling coming on, then making sure that the injured part is above the level of the heart. Again, as I said, elevation is quite important. So, if you've injured your hand and you see a bruise coming on, try and make sure that you have a couple of pillows above the level of your heart where you place your hand on when you're sleeping in the night. The stages of bruise colors is nice to know because often we see that, especially in Indian skin tones, we don't see the initial pink or red hues of the bruise very easily, and sometimes only when they become blue and dark and purple, etc., that's when people get worried. But that's the normal progression of a bruise. First it's pink and red, and then in a week's time it progresses through being very, very dark and very impressive looking, and then turning into a pale green, and then it takes about 2 weeks really for the bruise to completely disappear and for the normal skin coloration to appear again. So when to get help when you get a bruise? If there's no injury associated with the bruise, it's quite important to keep that in mind. Sometimes bruises can be a presentation of an occult bleeding or clotting disorder. So if somebody has got bruises and they don't remember, hurting themselves in any way, it's always better to get it checked, especially if they've got multiple bruises. If you suspect that there's a broken bone underneath the bruise, so if somebody has had a bruise after an impact and they're not able to move that particular arm or leg, that's quite important, and that means that there may be a broken bone underneath. And also just to mention, especially if you work in a care setting or if you deal with children in schools, etc., if you have any suspicion of non-accidental injury, and this is not only in children but actually also in vulnerable adults who may be at risk of abuse. So please keep these things in mind when it comes to bruises. Moving on to amputations. This is again another trigger warning slide. I will give you 5 seconds. So amputations are quite common injuries, and they occur when people catch their fingers on a slamming door, or they can also occur in sharp knives, utilization in an incorrect way, and mostly DIY stuff as well. So this one was someone who caught their finger at the edge of a door, and this one was a DIY that went wrong, unfortunately, and therefore they had amputations of 3 fingers. So I've now moved on to the next slide. For those of you who are looking away, please feel free to come back on the screen. The main thing to do with an amputation is when it happens is call 999 and remain calm. If this is someone that you're tending to, this is going to be the most important job for them, is to remain calm. And if you remain calm, the person in front of you will remain calm as well. Make sure that if you're tending to somebody else, you wash your hands and you wear gloves if you have, to prevent any infection, because these are very open wounds and can pick up infections very, very quickly, unfortunately. And apply steady, firm, direct pressure with either a gauze or a bandage or a clean kitchen cloth, whatever you can find the quickest. And applying that on the stump of where it's injured is very important. If after you've done that, you've noticed that the blood has soaked straight through, apply another gauze or another bandage or a cloth over the first one. Do not attempt to remove the initial bandage, and this is because if you do so, sometimes the initial clot can get dislodged, and ideally this should be done once the initial dressing is on. It should only be removed by a healthcare professional. Sometimes patients who have amputations drift in and out of consciousness. It's very important that you notice when this happens, and they can be because of multiple reasons. First of all, the pain itself is excruciating. Secondly, it could be because of the amount of blood that they've lost. And thirdly, it could also be because of the emotional distress that it causes, looking at the blood and looking at the injury itself. So if they are feeling faint or if they are drifting, in and out of consciousness, please make sure you lay them down on the floor and lift their legs above the level of the heart. And this is provided that there are no injuries on the legs to begin with. It's very important that you keep their body warm in a blanket. These initial stages of management help a lot in the progression of the disease later. With amputation, especially if they're larger amputations, keeping them nice and warm prevents any coagulation or clotting disorders later on in their hospital stay. So make sure you keep them warm. So now that you've tended to the individual with the amputation itself, it's time to look after the amputated part. Now, it's very important to understand that the amputated part needs to be minimally handled, because there are lots of very sensitive vessels and nerves that if they are disrupted, they unfortunately can prevent it from being reimplanted. So minimal handling, do not wash it or scrub it, leave that to the professionals, which might be the paramedics, which might be the doctors in the hospital. And make sure you place this part in a clean sealed Ziploc bag. If you don't have a Ziploc bag, any plastic bag will do, but it needs to be clean. And once it's in that bag, you can place it in another bag which is filled with ice and water. Always remember that the amputated part itself should not come in contact with the ice or water. In fact, it should always have the plastic covering on it. And if you do this correctly, the chances of it being reimplanted are much higher actually. So I'm now going to move on to burns. Again, this is a trigger warning site, so please look away. I'll give you 5 seconds. So burns can be quite superficial like this. You can hardly see this, but there is some red marking around the forearm over there. Or what you'd see more frequently in households is mothers getting these burns. Unfortunately, I'm being stereotypical. It can be anybody who's cooking. More frequently, the mothers who are cooking with hot oil or hot water that can get scars on their hands, and that can look like that. So I'm just going to go through the first aid of burns. And I've moved on to the next slide. So if you were looking away, please feel free to look back on the slides. The main thing is that you need to stop the burning process, and by this I mean removing the person from the area of the burn itself. And if there are active flames, then dousing the flames with water or smothering the flames with a blanket is very important. It's also very important that, a lot of the times nowadays, the material that our blankets are made of are polyester, and they can easily catch on fire as well. So just be a bit wary of what you put around them. You don't want to put anything more flammable around them. Make sure you do not put yourself at risk of getting burnt as well. I know we all want to help others, but you will not be of any use if you yourself become a victim as well. Then remove any clothing or jewelry that is in that particular arm, especially if you've got rings or bangles, making sure you take them off initially, because as a burn progresses, there is lots of swelling in that area, and then that can cause constriction of blood flow. Therefore, taking these jewelry pieces off earlier is much important. If the area that is burned has some adhered clothing on it or adhered material on it, do not remove anything that's stuck to the burnt skin, because as you take it out, sometimes it can cause more damage than good. So if anything is stuck on it, then don't take those things out. Cool the burn with cool or lukewarm running water, and this is for at least 20 minutes, not approximate 20 minutes, at least 20 minutes. So make sure you're watching the clock and do it as soon as possible after the injury. Never use ice or iced water to cool the burn. Always use just lukewarm water or at a temperature that feels comfortable, really. Please don't use any creams or greasy substances like butter or toothpaste on wounds. They cause more harm than good, and there have been no studies to prove that they work. Keep the person warm. Again, the same concept as applies with the amputations. Use a blanket or layers of clothing, but avoid putting, the blanket on the injured part, of course. Keeping them warm will again prevent hypothermia, which will prevent clotting disorders when later on in their illness. And if you've got cling film, you can apply cling film on the burnt area itself. Don't go round and round with the cling film, because that will constrict blood flow, but just one layer of cling film is sufficient. That reduces pain drastically, because the pain that is caused following a burn is because of the exposed nerves that are on the surface of the skin. Whereas if you apply the cling film, there's no draft of air that goes on these nerves, and therefore the pain reduces drastically as well. If there is any injury of the face or the eyes, then make sure you sit them upright as much as possible, and this is because it will reduce the swelling around the face. When to get help? So for burns, it's very important to get help if they're large burns. So by large burns, I mean anything more than the circumference of the hand itself. So if you look at the circumference of my hand, that's equivalent to 1% of my body surface area. And anything more than that circumference for me is a large burn. So if it's a child, just remember that their burns will be smaller, because they'll be based on their hand size. If there are deep burns, then it's very important to get help as well. So if you start seeing any blistering, it's important to get help. I'm sure a lot of us have had blisters before, and if they're small, we let them pop and they're fine. But just be a bit careful if you're managing these burns at home. You'd rather be sure than sorry, because sometimes even underneath the blisters, there can be quite deep wounds. Burns of any size that cause white or charred skin, you have to take them to the hospital to get treated, and this generally means that the wound is very deep, the burn itself is very deep. Burns in specific areas need to be looked into very carefully, especially on the face, for cosmetic reasons, of course, on the hands, because the hand performs lots of functions, and it's very important to make sure that the hands don't have any contractures, to make sure that we have appropriate functions of the hands. Then arms, feet, legs, genitals, any of these places, if they're burns, they need to be looked at by a professional. All chemical and electrical burns need to be treated in the hospital, and this is purely because there can be lots of other injuries with these associated. If the person has any other injuries that need treating, so sometimes a lot of burns are secondary to following an explosion, and if that's the case, then there can be lots of internal physical injuries that need to be reviewed by a hospital clinician. If people are vulnerable, regardless of the size of their burn, it's better to get it checked. And when I say vulnerable, for those who are on chemotherapy or on medicines that reduce their immunity, have HIV, or are young, the very young, the very old, pregnant ladies, and anybody who is at a higher risk of catching an infection, generally, I would say better to get it checked by a professional. And burns can easily be treated at a minor injuries unit. They don't necessarily need to go to the accident and emergency. If there's any suspicion of inhalational injury, so if anybody has been in a house fire where when they come out they've been coughing, or if they complain of sore throat, difficulty in breathing, it's very prudent that they go to the hospital. Sometimes there's not very much to see on the outside in terms of burns on the outside, but actually there can be burns in the airway on the inside, and therefore needs appropriate attention. So now moving on to road traffic accidents and what to do really in road traffic accidents. First things first is please call 999. We've reached a day and age where everybody has a smartphone, and somehow everybody reaches for the smartphone not to call 999 but actually to take a video of the accident itself. But please make sure that you call 999 first. If you are in another vehicle, switch on your hazard lights. There can be fire, petrol leakage, so make sure that all the traffic around has stopped completely. If there's anybody who's smoking near the site, make sure you ask them to stop smoking, because there's a higher risk of fires. And the next thing you've got to see is it safe to approach? So if there are any of those hazards that I mentioned, like petrol leaking, or if the vehicle itself is on fire, I would try and say wait for the emergency services to arrive, because they have the appropriate equipment to try and extricate people from this accident. You don't have a lot of tools that would protect you when you're approaching this. Always remember, screaming and crying is a good sign. So if there's somebody in the car who is involved in an accident, if they're screaming or crying, I know it's a horrible thing to say, but it at least means that they are able to feel pain and that they are conscious. We worry more about the people who are not conscious and have stopped speaking. So if they are able to speak to you, even if you're a bit further away, try and reassure them, try and speak to them and calm them down. If they come out of their car on their own, it's okay, you can let them do that. But I would probably say avoid helping in the extrication of individuals unless you see that there's an imminent fire or there's an imminent risk to the person, and they need to come out of their car immediately. Please try and avoid taking out these individuals out of their car, because in road traffic accidents, especially in high velocity accidents, there is a very high chance of neck injuries, and therefore if neck injuries happen, the initial movements are very important, and people can end up paralyzed for life really if the appropriate care to look after the neck has not been done initially. They might say that they're very hungry or that they want to drink anything. Please do not offer them anything to eat or drink. And this is purely because a lot of these people may require urgent operations. And if they've had anything to eat or drink, their operations, which are already high risk, become even more higher risk. If they're extremely thirsty and they're crying out because they're completely parched, try and see if you can just wet their mouth, but very, very small amounts of liquid to just wet their mouth, but absolutely nothing to eat, please. Unfortunately, with road traffic accidents, as a layman, reassurance is probably the best thing that you can do until help arrives. It's a very scary time for them. They're quite dazed. It's keeping them grounded, telling them that help is on their way, and telling them that they'll hopefully be all right. Call their next of kin, because often that's the one thing that takes the most time, and if you're by their side, it's something that you could easily do just by calling their next of kin and letting them know of what has happened. That's the end of my talk. I'll take any questions now. Sairam.
Jai Sairam. Thank you very much, Dr. Sneha Singh, for such an informative talk. I was particularly struck by your message of approaching challenges which may face you in a calm, cool, and collected manner, which I think is not only true for the injuries that you have described in such a structured way, but also about all of life's challenges that may come in our direction. I have a few questions and queries that I wanted to ask, beyond some which are beyond the scope of the talk that you've already spoken about. But when considering things like an emergency situation, what would you do if you're presented with somebody who is choking?
That's a really good question. Thank you so much, Dr. Jayanathan. Choking is one of those things that you can see any day, really, when you go out to a restaurant or anywhere. So I think it's quite important to try and if somebody is choking and if they're coughing, if they're actively coughing, let them cough is the best thing to do, because that's their body trying to get rid of whatever's stuck in their airway. Sometimes younger children need a bit of help, so some pats on the back generally help as well. But if they've reached a stage where their breathing is being affected and they're not effectively being able to cough, there's a very nice maneuver that I would encourage the audience to look up. It's called the Heimlich's maneuver. It's spelled Heimlich. Whereas you essentially give the person a hug from behind, and you cup your fingers around a fist of the other hand, and the motion is back towards yourself and upwards, and that generally tends to dislodge the foreign body that's stuck in the throat. But I would probably encourage that this sort of thing needs to be done with training, because if not done appropriately, it can cause more harm than good. And if you think that you're going to go down needing that maneuver, you should be calling for help.
Yes, thank you. I mean, we're sometimes faced with people who may collapse or faint in front of us. I mean, what are the sort of things that you think that we should be doing when approaching somebody like this?
So most simple faints, people actually know that they're going to faint, and they will tell you that they're starting to feel a bit unwell. So they start saying that the best thing to do is to lay them down on the floor. But sometimes you've arrived and you've seen that, oh, there's not very much of a warning sign, and they literally go down. The best thing to do is make sure that they are safe. So, if they are going down, support them and lie them on the floor. And lift their legs up above the level of the heart, because that brings back all the blood in the legs, goes up towards the heart and the brain, and therefore they regain consciousness very early on. Simple faints don't really need to come to the hospital. So if you've been in the London Overground for an hour and you're dehydrated, it's quite possible that you will faint. But things to worry about with people fainting, especially if they're elderly, if they've got lots of medical problems, if they've had any chest pain or breathing difficulty, or if they had no warning symptoms at all. These are things that we would worry about and would warrant a quick trip to the emergency department to figure out what's going on.
Would that change? How would you recognize if somebody is having something like a seizure? Because I guess these things can look quite similar. And would you do anything different?
So seizures, of course, they will have lots of violent shaking, and it can be quite scary because they often go quite blue around their lips because their breathing is altered during the seizure. With seizures as well, it can happen quite suddenly. They fall onto the ground. They might give a very loud cry as well right before they do that. And some of them can be incontinent of their urine or their feces. So, of course, trying to maintain dignity as much as you can when they're having the seizure is very important. Make sure that you have enough space around the person who's having a seizure, because they do tend to move a lot. Both their arms and both their legs are violently shaking. And don't put anything in their mouth. So that's the other thing. Absolutely nothing to put in their mouth. There was a long time ago, there used to be a practice where people used to put spoons in people's mouths to prevent tongue biting. But actually, the first onset of seizure, whatever tongue bite is, whatever tongue injury has to happen has already happened. And then once the seizure stops, laying them onto their left side is what's recommended, to make sure that their airway isn't obstructed and that they're able to recover from this on their own. But by this point of time, I would have expected that somebody would have called 999, and hopefully they would arrive relatively soon for these sort of presentations.
Okay. Thank you. I was going to ask about sort of allergic reactions. I guess that there are maybe more simpler ones and maybe more complicated ones. I guess in the same way, how can we recognize, that an allergic reaction is happening, and what kind of things can we do to sort of help the situation?
So allergic reactions are a very wide array of presentations. There can be something simple like contact dermatitis. So, if you're allergic to certain jewelry or certain products and you apply it in a part of your face or a part of your body, and then you get a rash just over there. And those are relatively minor. And that's something that the pharmacist can give you medication on, something like Piriton or some cream, etc., can help with those. When it comes to allergic reactions, I think we mostly worry about anaphylaxis, which is increasingly common now. And those are very systemic reactions where you get a very widespread rash all over the body. The tongue gets swollen, people get difficulty in breathing. Their eyes can be a bit swollen as well. The entire face can get swollen. And this is a very time-critical illness, really. So the first notice of an allergic reaction, which is causing any difficulty in breathing or any difficulty in swallowing, or the tongue looks swollen, 999 would be a best shout. And most likely they will have to administer some adrenaline to help with all of this swelling, because within a few minutes this can be fatal.
Thank you. When it comes to other things that I've seen is which can look quite dramatic, is things like nosebleeds. I think it can be, you know, when you've got a face which has just got blood all over it, it can be very, you know, anxiety inducing and even panic inducing. I mean, what can you do in that kind of situation?
Yeah, you're absolutely right, Dr. Jayanathan. With nosebleeds, because the nose is such a vascular place, there's so many blood vessels there. A minor injury can cause a lot of bleeding. It's very important to differentiate whether it's a traumatic bleed or a non-traumatic bleed. So if there's any associated injury with the nosebleed, the blanket rule is that you always need to get it checked out by a clinician. If there's no associated injury, and if it's a child, sometimes children do get nosebleeds, especially in this sort of weather where it's dry and cold. The best thing to do is, first of all, not panic, because it is a scary thing. The nosebleed itself usually is not painful, so that's a blessing. And to use, basically pinch the soft part of your nose with your index finger and your thumb, just at the soft part of your nose, and hold it there for at least 15 to 20 minutes. And again, looking at the clock and holding it there. Always making sure that you're leaning forwards and not backwards. So whatever is coming out in your, through your mouth or through your nose, rather than you swallowing it, because swallowing blood is not very pleasant, is what I've heard. Often some people also prefer putting a bag of peas or ice packs at the back of the neck or on the forehead. And there's limited data to say that this actually works, but for some people it does, and it doesn't do any harm. So I would probably say to try that along with the pressing of the nose. If you notice that the bleeding has not stopped even after 15 or 20 minutes, or if it's a recurrent bleeder, so if you're getting bleeding every day or every few days, it's better to get it reviewed by a clinician. Alternatively, if a person is also on blood thinners, that needs to be looked into. Or if a person has got high blood pressure, make sure you check the blood pressure. And if it's high, they need to come into hospital as well.
Yes. Thank you. Can I ask, I mean, what do you advise about sort of foreign bodies in ears? I mean, by foreign body, I mean something that shouldn't be in an ear. What would you sort of advise in that sort of area?
I'm sure all parents would have gone through something similar with toddlers and kids. So it's a very valid question. Foreign bodies in ears are very, very common in children. Just be reassured of that, first of all. Most, actually, if not all, most of them need to be taken out in the hospital because of the instruments that we use. They're quite difficult to take out at home. We generally differentiate foreign bodies as organic or non-organic. So if it's a small toy, like a small bead or something like that the child's put into their ear, that generally is not something that we need to take out immediately. That can wait. Like if they've put it, 10 o'clock at night, you can come in the morning and get it removed. Alternatively, if it's something organic, so if it's a food, like a grain of rice or some other thing that can decompose, that has increased risks of infections in the ear. And therefore, those things, generally, we tend to want to take out a bit quicker compared to the inorganic ones.
And can I ask, when it comes to cleaning ears, when it comes to things like cotton buds and things, what would be your advice about cleaning the ears?
So most people, I know a lot of people use cotton buds, but it's actually not advisable, because what it does is it just pushes the wax just further into the ear and therefore worsens any ear conditions. The best thing to do really is, let your ear do its own thing. You've got very, very small hair in your outer ear that helps clear out the wax and pushes it towards the outside. And that should do the job. God has created the ear perfectly. So avoid putting things inside the ear is what I would say. If you do have recurrent ear problems, then the ENT doctors would be able to advise you on what to do. And things like wax, etc., you can look up online regarding olive oil and things that you can put into your ear that just liquefies the wax and helps it ooze out of the ear overnight. But yeah, definitely try and avoid putting anything in the ear.
Okay, thank you, thank you. And can I ask what's the strangest thing that you found inside an ear? And we can compare notes. I've got a story myself. So what did you see?
So the one that I saw was a live cockroach.
Wow.
And that was when I was practicing in India, and it was a live cockroach, a baby live cockroach, which unfortunately we had to drown in some water before we could fish it out of the ear. So yeah, that that was
Wow.
mine. How about yours? Tell me yours.
My one, I had a mother bring in her son, who was about sort of 8-9 years of old, and was saying that he's not hearing very well, and he turns the volume on the TV quite loud, and I call his name and he doesn't come, and I was just thinking he sounds like a perfectly healthy, normal 8-9-year-old. I looked in one ear and it looked completely fine. I think I looked in the other ear. And I looked at him, and then I looked again, and then I looked at him again, and I said, I don't know whether I'm seeing this right, but I think I can see a tooth in here. And he looked a bit sheepish, and he was like, yeah, no, I put it in there when it fell out. So I'm not entirely sure how long it was there, but certainly I did need to point him in your department's direction so that it could be removed safely. But certainly the strangest thing that I had seen.
Absolutely. I don't think I've ever heard of that story before. This must
Indeed. Again, I need to, I think that I've run out of questions, and I think you've done so well at answering all of these and giving such a, as I say, such a clear, structured, cool, calm, and collected, sort of approach. And I think it's been so valuable to be listening just to these common things that we think that we should know how to deal with them sometimes, but actually it's good to know to bust some of the myths, and to have this sort of cool structured approach is really, really so helpful. So my sincere thanks to you, Dr. Sneha Singh, for spending your time with us this evening and talking through all of these things. Thank you so much.
Thank you very much for this opportunity, and I thank Swami for giving us this platform and guiding us through this. And I hope that some people learn some things, and I'm happy to improve as well. So if there's any recommendations or anything else that you would want me to cover at a future webinar, please let me know.
I'm sure that we will have you back. You have a wealth of knowledge and experience to share with us. I also extend my thanks to our beloved Bhagavan for giving us all this opportunity to meet together like this on a monthly basis to discuss health-related matters. I give my sincere thanks to the IT and technical team, without whom we would not be able to do anything. You wouldn't see us, you wouldn't hear us at all. I give my thanks to the entire SAI National Healthcare team for their continual planning and execution of these monthly talks, and finding the most experienced and intelligent healthcare professionals to come and deliver these talks. I thank you, the audience, who join us every single month. So thank you, and please, I'm sure that we are going to catch up at our next webinar, which is all the way in next year, in 2022, on Tuesday, the 4th of January. This is going to be presented by Dr. Sunil Agrawal, who's a consultant cardiologist based in Liverpool. It is my pleasure, on behalf of the SAI National Healthcare team, to wish you a Merry Christmas and a peaceful, prosperous, and healthy New Year. Jai Sai Ram.
Sai Ram.